So my name is James Kinross. I'm a senior lecturer in surgery at Imperial College in London. So in my practice, I see patients typically within the clinic who have been referred to me by their general practitioners because of a change in their symptoms, typically rectal bleeding or an altered bowel habit. And my job is to screen them for signs of cancer and to refer them on to endoscopy if indicated. So I often use this device as part of my initial clinical assessment, but I use it in other settings too. I use it in the assessment of rectal pathology, for example, complex polyps when I'm trying to make clinical decisions about management. And I also use it in the assessment of proctitis, inflammation, or conditions where I need to serially examine the rectum to tailor treatment. It's a very useful device in the management of benign disease. So we use it a lot in the treatment and diagnosis of simple conditions such as hemorrhoids. Patients greatly enjoy being able to see the pathology and to have an objective assessment of their clinical problem. So the LumenEye is not really comparable to standard rigid sigmoidoscopy. It has several really important innovations that give it a completely different set of capabilities. The first is that this is a digital device. It has a high definition camera that links to a piece of software. That means you can objectively standardize your procedure and capture information on pathology and record that information as part of a medical legal documentation. It also means that you can share and communicate with your peers and colleagues when you have pathology that you are unsure of, and you can do that in real time. The device is ergonomic and it's designed to improve not just the clinician experience of care, but the patient experience of care. It has a pneumatic handle that allows you to insufflate the rectum whilst you're advancing the camera under direct vision, and it allows you to perform biopsies without losing pneumorectum. So it means that you can take biopsies in the outpatient setting in a really very standard and easy manner. So really, I found in my practice that it's replaced the need for flexible sigmoidoscopy in many instances. I just don't need to do it. I can do it affordably and cheaply at the point of care. We've also found that it allows primary care physicians and doctors to be able to do this within the outpatient setting in their own clinics in the community. So a major part of this technology is it's entirely flexible. It can be used by primary care physicians with minimal training, and actually in about 96% of occasions based on the data that we've observed from our preliminary trials, you can actually reach a diagnosis of primary rectal pathology. So it's really transformative. We believe that with the LumenEye technology, in the presence of a negative fit test for normal hemoglobin, actually that we can confidently rule out the need for flexible sigmoidoscopy in around 17% of the cases that we currently refer on. So, the 17 to 20% reduction in the endoscopy burden is really very significant. And we can do that at the point of care, we can do that in the community at the GP practice. So we can even save that patient being referred into the secondary care setting. So the reason we can do that is because it's not just because that we have an advanced technology that allows us to objectively and accurately measure pathology within the rectum, is that we have the software to capture that image, store that image, and have an ability to share that information with our peers. So it's genuinely transformative.